Continuing on in the reproductive chapter on growth, I'm on page 661, and we're starting up here with multiple births. So we just talked about childbirth of the baby. Well, how does this whole process differ if there are two babies? So let's talk about how two babies happen, first of all. You may have heard of fraternal twins, and then we have identical twins. So fraternal twins are not identical, even if they look alike. With identical twins, you get one egg and one sperm. So the baby starts being created. And then for some reason, and there's really no rhyme or reason how it happens, it splits in half. So when it splits in half, the DNA is identical. One egg, one sperm. And then they continue to grow. Oftentimes, actually, not oftentimes, all the time, they will only have one placenta here, because the split happens after the implantation. And so they get one placenta, two umbilical cords, and typically 2 bags of water. Although there's some variety there. With fraternal twins, or your non-identical, you have 2 eggs, 2 sperm. So these are not going to have identical DNA. So when you have 2 eggs, 2 sperm, they could both be girls, both be boys, or have one of each. These are going to be, obviously your girl-boy twins are not identical. But even when you have 2 girls or 2 boys, they may look alike, but if they came from 2 eggs and 2 sperm, they're not identical. They're actually no closer related than brothers or sisters that were born at different times, because they came from the same parents, so they have similar genetic pool, but they came from 2 different eggs and sperm. So just like you may be able to think of brothers and sisters you have that you look like, and then others you don't look like, or I'm like them in this way, but I'm not like them in this way. I got this from my mom, and you got this from dad. The same as with these twins. Okay? They could look alike, they could be very different. My sister has 2 daughters. One is very blonde, very pale skin. The other one, very dark, very olive skin. Got them from different genetic parts of their gene pool. But they're sisters, full-blood sisters. So the same could happen with these fraternal twins. With these, because you have 2 eggs, they both have to implant into the uterus, meaning you have 2 placentas. So if you have twins, the doctor can tell immediately from your first ultrasound if they're identical or not identical. The identical twins we call monozygotic. Remember we talked about the zygote? Mono means 1, so 1 zygote, monozygotic. And then for your not identical twins, not identical, we call them dizygotic, di being 2. I know bi also means 2, but di does too in this phrase. Dizygotic meaning 2. Now, the same could happen for triplets or quads. I mean, you could have non-identical triplets. You could also have 2 eggs, 2 sperm, and then one of them splits. And so these 2 are identical, and then the third triplet's the extra. Like, it could be all of these weird combinations. The other thing that can happen with this kind of twin, because it's 2 eggs, 2 sperm, they could have 2 different fathers. The female could have had partners within a day of each other, and one guy fertilized one egg and the other guy fertilized the other egg. So you don't necessarily have to have the same father. I know that's kind of wild to wrap your head around there, but that's possible. Now, in order to have that kind of twins, the female had to have released 2 eggs that month. Now, normally, the female only releases 1 egg a month. But with This kind, obviously the female's body released 2 for some reason. So, implantation disorders. So we talked about how when that egg implants into the placenta and it starts growing and baby attaches to it, if you look at this picture, notice how the placenta is growing over the cervical opening. Now, baby can grow that way. This is not a problem for baby's development, but we can't give birth like this. Baby, the cervix opens for baby to come through, and there's a placenta in the way. Baby can't get out. This is a condition called placenta previa. It is a problem for childbirth. Now, with an ultrasound, we can identify this condition early. And this would be a woman that the doctor would say, we have to do a C-section. I don't want you going into labor at all. So we're going to maybe do a C-section at 39 weeks before your body goes into labor. And we need to control this birth because it can be very life-threatening. Now imagine 100 years ago, 200 years ago, when these kinds of medical advances didn't exist, this could have very well killed mom and baby in childbirth. The next condition here that we are looking at, you can see that the placenta is starting to pull away from the lining. It's causing hemorrhaging, which is causing bleeding. You're still pregnant, but you're bleeding. And so every now and then you'll hear a woman say, I still had periods while I was pregnant. You're not supposed to. This could have been happening. So I've heard students of mine say it like it was no big deal, and I'm thinking that's a big deal. Like that's not something just to not be concerned about. That's not supposed to be happening. Preeclampsia. Preeclampsia can advance to eclampsia, and we don't want that to happen. Women, about 1 in every 20 women who are pregnant experience symptoms here. The biggest one is high blood pressure. Another key way of diagnosing is protein in the urine. So if you've ever been pregnant, you know that almost every checkup you go to, they want your urine. And they're actually testing for protein. You should not be spilling protein into your urine during pregnancy. And that's what they're testing for every month, just to make sure that they don't miss anything. If we do identify a woman and diagnose the woman as being preeclamptic, now we're going to watch them very closely. Their blood pressure is a problem. It can cause that separation of that placenta that we just talked about, a stroke in the mother, fetal malnutrition and low birth weight. If it continues into eclampsia, coma, kidney failure, and death of both mom and the baby. So we watch them very, very closely if they've been diagnosed with preeclampsia. Any fans of Downton Abbey? That is how Sybil died, was preeclampsia that advanced to eclampsia during childbirth. And that would have been around the 1920s that happened for anyone who doesn't know the show. Gestational diabetes. Again, very, very common in women. This is typically someone who has gestational diabetes was not diabetic prior to being pregnant. And it seems to be just kind of a common thing that the woman's body can't handle the sugar during the pregnancy. Normally this goes away after birth happens, although it does put you at risk of being diabetic later in life. But typically it just goes away and it's not a problem anymore. How do we test for this is about halfway through the pregnancy, around the 20-week mark, you get to drink this fabulous beverage, which to me tastes like flat orange soda. That was my opinion of it. And you drink it, 8 ounces, 10 ounces, whatever it is, and then your body does its thing. We then take your blood about an hour later, and we test your sugar levels Was your body able to handle the beverage that you consumed? If it could, then your sugar levels are fine. If it couldn't, you may have gestational diabetes, and we're going to watch you a lot closer. This can cause, untreated, it can cause very large babies, which of course can make it very difficult to deliver because they are 12 and 13 pounds sometimes. They're very big babies. Hey. Fetal death. We call this different things at different points depending on where the death happened. If it happened before the 20th week, we call it a miscarriage. We don't really know why these happen sometimes, why a woman loses the baby. Sometimes it's a genetic problem that the infant had very significant birth defects based on the egg and the sperm combination, that the body just ends it naturally. Other times it could be that the woman has uterus problems and the mother's body couldn't handle the pregnancy, where the baby was a great genetic baby, but the mother's body couldn't handle it. We just never really know. And unfortunately, there are some women who continue to miscarry, that they desperately want a baby and that they get pregnant just fine, and their body, for some reason, miscarries it repeatedly. So doctors, of course, can work with that patient very closely. So in healthcare, we call any loss of a baby to be an abortion. Normally, when we hear that word, we think of the woman's right to choose, which is an abortion. We call that a legally induced abortion. But any loss of a baby is called an abortion. So a miscarriage is called a spontaneous abortion, meaning that the body did it for some reason. Unplanned, and certainly wasn't what the mother wanted. So we call it a miscarriage if it's before the 20th week. If it's after the 20th week, we call it a stillborn. You'll see some variations in these when we get into coding for these types of conditions that you'll be doing this module. And then we can have a variety of birth defects in the baby that is born. Birth defects certainly can come from genetics. It's just a combination of egg and sperm caused it, but it can also be caused by exposure to radiation, toxic chemicals, smoking, drinking, street drugs, also different infections that mom may get or have prior or get during the pregnancy. We use the word teratogens, which is an exposure to an environmental factor, which are what I just talked about. So if, let's say mom has cancer and is undergoing some really strong radiation treatment, that can affect the infant that's growing inside. Last section before I stop this video, and then we'll start up the rest of the chapter to the next video. Postpartum, we could have infections of the mother. It used to be called childbed fever. Prior to modern medicine, doctors didn't feel the need to wash their hands. So up until the 1930s, this was the leading cause of the mother after giving childbirth. 20% of women died after giving birth for seemingly no reason. Okay? Because, first of all, we didn't have antibiotics in those days, but also doctors did not feel the need to wash their hands. They did not understand germs, and they did not understand spreading of germs. They didn't wear gloves, they didn't wash their hands, and so they would go from taking care of baby, and the infection would get up into the mother's vaginal opening and infect the mother. There are even stories of going from doing an autopsy to delivering a baby without washing their hands in the middle. So it obviously, in our culture today, we think that and go, that's insane. How did anybody think that that was a good idea? But it was normal. Mastitis is inflammation of the breast. Can certainly cause a variety of things. We can have black milk ducts, things like that. Some women, because of these types of inflammations, actually cannot produce milk. And of course, we have formula options nowadays. Again, 100 years ago, we had very little options. But nowadays, of course, we have very good options. We also have babies who are lactose intolerant right from the get-go. Again, great advances here where we can do different soy-based formula for that baby who needs a bottle but can't handle the lactose. And so definitely things to think about should have a fussy baby and milk is, every time they eat, you've got issues, perhaps consider the non-milk alternatives may make a difference. This doesn't mean they're going to be lactose intolerant their whole life. A lot of babies who are born like that can grow out of it. Their just body isn't ready yet, but maybe they can handle lactose as they age, and then other babies may be like this their whole life.